Hi everyone, Jennifer Blevin-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today, I just want to do a quick video about patient safety. Patient safety honestly should be one of the first factors that you consider when making a decision in your practice, whether it's an administrative decision, a workflow decision, a documentation decision, any decision that you're making. Honestly, there's very few in your practice that should not consider patient safety. Even when it comes down to staffing, right? Making sure that you have enough people on staff at any given time to make sure that your patients are happy, that they're safe, that you're making sure you're hiring people who are qualified, and that you trust. Patient safety, I don't want to say I feel like it gets overlooked because I don't think that's fair, but I do think that it's maybe not one of the top considerations when making business decisions in healthcare practice. Unfortunately, with not having the proper mindset of putting patient safety first, it could put you at a high liability in a way that maybe you aren't even realizing, especially if you're new to managing a practice, you're new to running or operating a practice, you're new to owning a practice. There are so many things that you have to track. There are so many things that you have to be aware of and consider and think of and juggle. I get it, done it. I totally know. But at the same time, anytime you're making a decision, it could affect patients even indirectly. So let's say you have disgruntled staff. They might not care about doing their job as well as they should. And maybe they're making errors that they shouldn't because they don't care or they don't understand, maybe even why it's important. And you miss getting a message from a patient, you miss getting a phone call from a pharmacy. Those things could directly affect a patient's well being. Because if you're not aware that a patient's having a side effect or that they're having some kind of question that they need assistance with, or the pharmacy has a question about maybe a drug interaction when you prescribe something and they need to work something out with you, or they're waiting on getting your answer before they dispense a drug to a patient. They're waiting for their therapy because they're waiting on you, but you don't know they're waiting on you. Stuff like that can directly affect patient care and patient safety, patient satisfaction, and ultimately in healthcare, we're in customer service. It's just a different kind of facet of customer service, but nonetheless, it's customer service. And these customers can sue you if you harm them. I mean, you have a very big responsibility. Not only can providers be sued, but staff in some situations can be sued as well. It's just one of those things where a lot of people are making business decisions because it is a business, but they're not taking into account the customer service side or the patient safety side. I just want to put this video out there to bring awareness that patient safety should be number one, and it should be considered when making decisions. So if you're thinking about not hiring someone when you feel a little short staffed because it's going to make funds tight, or you aren't maybe going to get rid of the staff member that's not doing what they're supposed to be doing, or you aren't going to be keeping some medications or something on hand because it's too expensive and it's not used very often. You really have to juggle these decisions, because what if that one time you get that one really sick patient and you don't have Rocephin because you didn't want to keep it on the shelf because every time you buy it, it expires and you lose money? What if you don't have crutches in there and you have somebody come in and they fall in your office and they need crutches to help them to their car and to go to the ER or the urgent care to get x-rays? What if, right? And I'm not saying that you should live in what if and be scared and like overspend and have all this extra inventory and stuff. What I'm saying is that you just have to really consider your patient safety, measure and weigh out your pros and cons of everything, and decide, is it worth the risk or not? Is there a risk? How high is the risk? just really taking into account all of this. No provider, no doctor, no owner wants to put their patients at risk, and I know that. But sometimes we do it without even realizing we're doing it. I have a lot of new providers watching my videos. I have a lot of new provider owners, like they've practiced for a long time, but they've never ran their own practice, watch my videos. And I just wanted to put this out there because as a certified medical assistant and somebody who loves patient care, and I just I really want to emphasize that patient safety should be number one and in the forefront of the mind when making decisions about the practice and how it's going to affect everybody. Patients can tell when you care and when you don't care. They can tell when they come in and people are genuine and are there for the right reasons, and the people who are not in practices. I know that people who got into healthcare are usually into it because they want to help people. Sometimes we get so caught up in all the bureaucracy and the politics and the requirements and the compliance and of healthcare, we forget about the number one thing that we got into healthcare about, and that was the patients. So patient safety should be at the forefront of your brain, documenting things appropriately, educating and training your staff, no matter what their role is, to make sure that they're comfortable in their role, they understand what their roles are, why they do the things you ask them to do. Documentation with interactions of patients is really important, and showing them how to do that in a very thorough way, making sure that they understand how important it is that they communicate to internal staff when patients call or need something, or someone on behalf of the patient is calling and needing something, things like that. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with your colleagues whom you feel would benefit. I appreciate the support. We will see you next time. Bye-bye.